Ha salido una notificación que decía que decía yo y yo puse el azul que es no sé.
Hi, everybody. Hi, welcome, Lucia, Alejandro, Fernanda. How are you tonight? Good evening, Lucia. Nice to see you. And Luis, thanks for being on time. It's 8 o'clock. It's your choice if you start now, or maybe we can wait maybe 2 or 3 minutes to your classmates. That's okay for me if you want to start now. We're going to check some grammar tips, and then we have lots of information to resume in just 1 hour. I hope we can finish on time. Hi, Dennis, how are you? It's nice to see you. Hi, Angelica.
Hi, good night.
Hi. Okay, give me a second, please. Okay, let's start taking notes. Okay, let's start. I think your classmates are coming, I don't know, but we have too much information to check tonight. Can you see my screen? Yes, is that okay? It's a green presentation, I mean. And well, as you can see, we have 61 slides, 60, I think. That's why I'm trying to make my best effort in order to complete all the information. First of all, we have to consider that talking in English, in medical English specifically, we might consider that it's a fact that we can get in confusion because of some prefixes and suffixes. That's why we have to start with that introduction, talking about prefixes and suffixes, of course, okay? In English, that kind of information is so long. We have to consider that we have 4 types of word parts that are very important in order to understand the meaning of the medical term. And sometimes we can combine those meanings, and we can create the terminology in order to make a deduction about what we are talking about. And we can combine or understand while dividing the word if we remember these grammar rules. The word root contains the basic meaning of the term. For example, gaster means stomach. Moreover, we combine the form, the word root plus the vowel, adding at the end. For example, gaster, the word root gaster plus an O, now is gastro. And we know this. The suffix usually, but not always, indicates the procedure, condition, disorder, or disease. Gastroenteritis, for example. Gastritis, for example, right? And the prefix usually, but not always, indicates location, time, number, or status. We are going to see examples specifically from this part, okay? For example, we have the word part guidelines, talking about the word root, that explain us the rules, what about we are talking, okay? First of all, a word cannot stand alone. It means that the suffix must be added at the end of the word to complete the term. If you just say Guster, or you consider that it's a good abbreviation, for example, it's a mistake because you're not telling anything when you talk about this. That's why you have to understand that the suffix is one of the most important parts at this moment in order to get the correct construction of the words, okay? Moreover, the rules for creating a combining form by adding a vowel apply when a suffix is beginning with a consonant and it's added to a word root. We are going to check some examples. When a prefix is added, it always plays at the beginning of the word. So it's obviously, it's the same as in Spanish. We have the suffix at the end of the word root and the prefix at the beginning, and that's all. But we have to consider if the suffix has a consonant like this, or has another kind of word. A vowel, I mean, not a consonant, a vowel. Word roots and combining forms indicated in color. I mean, we have this color in magenta with the adding word, and it's showing us the meaning, ciano. Cian is the word root with the suffix O with the vowel combination. Ciano, we know is blue. Now, cyanosis, this is the pronunciation. Is the blue discoloration of the skin caused by a lack of adequate oxygen? We know what cyanosis is, but we have to check how this word is constructed. Word root, the vowel combination, and the suffix cis, we have the condition, right? Alejandro Martinez, can you listen to me?
Yes.
Alejandro.
Yes, I'm listening.
Yes, hi Alejandro. Can you read the rest of this?
Yes.
Erythroleucin, melanoma, polio. Can you read this chart, please? Patient, okay?
Okay. Erythro means red, and erythrocyte is a major red blood cell. Means. Can you sum the? Means red, and cyte means cell. Leuc or leuco means white. Leukocyte is a white blood cell, and leuc means white, and cyte means cell. Melan or melano means black. Melanosis is any condition of unusual deposits of black pigment in body tissues or organs. Melan means black, and oosis means abnormal condition or disease. Poly means gray. Poliomyelitis is a viral infection of the gray matter of the spinal cord. Poly means gray, myel means spinal cord, and itis means inflammation.
Thank you so much, Alejandro. So you can see the word root, the vowel adding, and the suffix, and then you get the medical term. That's the objective of this, to get the idea that we can construct and we can evaluate, make a deduction of the meaning if we know how to prepare and divide the word. We have, on the other hand, going ahead, the suffixes, the most common ones. We have these three kinds of suffixes that are not going to change. We have noun endings, I mean, a, e, us, y. It's a grammar rule that it's not going to change. When you find these 5 suffixes, these noun endings, you know that something is going to be a noun. It's easy to make. For example, crani, the school, plus ium, cranium. And we know what we are talking about. For example, suffixes meaning abnormal condition are all of these 7 ones. Ago, isis, aya, iasis, ion, ism, osis. An example, gastro, stomach, plus osis, gastrosis. We, during the med school, we're studying what's the meaning of this, of course. And it's easy to understand that we see the suffix, we know it's an abnormal condition. Suffixes meaning pertaining to, we have all of these. Then 14 suffixes. Cardi plus cardi, that it's heart, plus AC, cardiac. This medical term belongs to the cardiac, to the heart. So we have to consider this, okay? It's an informative slide, I mean, but it's very useful when you are reading the medical terminology, and it's easy to prepare and to check when you have a doubt about it. That's why we are using this. Moreover, we have suffixes related to pathology. Lucia, can you listen to me?
Yes, I can.
Yes, thank you, Lucia. Can you read this slide, please? Just
Yes.
the chart.
Okay.
I'm sorry. Okay, go ahead, please.
Okay. Algia means pain and suffering. As an example, gastralgia. Dynia, pain. Gastrodynia. Itis, inflammation. Gastritis. Megaly, enlargement. Hepatomegaly. Malacia, Malaysia, abnormal softening.
That's okay.
Arteriomalacia. Necrosis, tissue death. Arterionecrosis. Sclerosis, abnormal hardening, arteriosclerosis. Stenosis, abnormal narrowing, arteriostenosis.
Thank you so much, Lucia. So you can see these suffixes are not going to change. We can guess the meaning if we know this way of relation. The same as in Spanish. Moreover, we have suffixes related to procedures. We have to consider them because during the medical school we were practicing, and indeed we get the meaning. While practicing, we get the meaning, we understood that it's working in that way. But in English, of course, it's useful in order for not running mad and getting crazy because of a situation that we need to translate. And well, we have to practice this. Karen, can you listen to me? Karen? Okay. Okay, doesn't matter. Natalie Irigoyen, because I have two Natalie's. Natalie, can you listen to me?
Yes, miss.
Oh,
Thank you, Natalie. Can you read this slide, please?
Okay. Synthesis. A surgical puncture to remove fluids for diagnostic purpose to remove excess fluid. Example, abdominocentesis. Graphy. Process of producing a picture or record. Angiography. Gram. Picture or record. Angiogram. Plasty. Surgical repair. Myoplasty. Scopy. Visual examination. Arthroscopy.
Thank you so much. So you can see it's the same as in Spanish, just not getting mad about this. Easy to make, easy to practice. But as I was telling you at the beginning, it's for practicing, for reading, the way of getting used to, and that's all. Now we have grammar rules for writing down. For example, the double R suffixes, okay? The Raj and Raja, Rafi, Ria, and Rexis, they are not going to change by any way using the double R. It doesn't matter the situation, you must write down with those double R, okay? Dennis, can you listen to me? Dennis
Yep.
Molina.
I'm a leader.
Yes,
You want me
thank
to
you.
read?
Thank you so much. Can you read this slide, please?
Okay, the double R suffixes, rash or rasha, bleeding, sudden severe bleeding, hemorrhage or hemorrhagia, roughing, surgical suturing close of a wound, close a wound. The use of sutures is staples or surgical glue. Myography, rare,
The RIA.
low, RIA,
RIA,
so
yes.
low discharge of most body fluids, diarrhea, rhexis, rupture, myorrhexis.
Thank you so much, Denise. So you can see this grammar rule applies in all of the examples, and of course in all of the words you're going to use this. Okay, it's important to write down in the correct way because we don't want to be a piece of joke. I mean, when working with or studying with or talking to American or England doctor or any country, we must use the English medical terminology. It's important to get it in count, okay? Talking about prefixes, of course, we all know what a prefix is. It's added at the beginning of the word to influence the meaning of the term. For example, prenatal, perinatal, and postnatal. The prenatal times an events before birth. Perinatal times and events surrounding the birth, and postnatal time and events after birth. Easy to understand. And we have the constructing word prenatal. Prenatal. You see, this is a three-word constructed. Okay. Now we have more prefixes that are describing direction, quantity, size, and amount. The same that I was telling you, in Spanish, we get the idea indeed during the med school. I tell you by experience, of course, maybe in your med school was different, but now we have to consider these prefixes. Ab, dextro o dextro, ex, macro, mega, megalo, pre, ad, sinistro, in, micro, oligo, and post. Of course, there are so much more that we are going to find during the course and while reading articles and books, but that's the idea we must get, okay? Ivana, can you listen to me?
Yes.
Thank you so much. Can you read this slide, please?
Prefixes describing direction, quantity, size, and amount.
Yeah.
AB away from negative absent. ID toward to in the direction of dex or right side. X out of outside away from. Macro, large, abnormal size or long. Mega, omega, or large, great. Pre, before, at, toward to, in the direction of. Sinistre, left or side, in, into, not, without. Micro, small. Only, scanty, few. Post, after, behind.
Thank you so much, Ivana. So you can see this. Let's go ahead. Moreover, we have contrasting prefixes, I'm sorry. As we were checking, Ivana was reading, up means away from, abnormal, for example. This means bad, is dysfunctional, for example. Hypertension, interstitial, that's okay. Subcostal, addiction, eupnea, hypotension, intramuscular, supracostal. You can see, you can check when we get the idea that are contrasting. For example, hyper and hypo. We know in Spanish, hypertension, hypotension, easy to make. Just for practicing, for remembering, for getting the idea that it's the same as in English. But now we can read, we can understand, and maybe we can construct the medical term without any trouble. As a grammar tip, a very important grammar tip, we have these unusual plural forms. The unusual plural forms, of course, are important in order to not make a mistake while writing down the clinical history or reporting a case. When we had, during the guideline, we have the rule, for example, because it's gonna be self-study, please, it's a very long picture and we are not with enough time. If the singular term ends in a suffix A, the plural is usually formed by changing the ending to AE. For example, in singular, we have bursa, in plural, bursi. Or it could be written, read in any other countries as bursa again. We have vertebra, in plural, vertebra. The pronunciation is the same with these specifically. Another one, if the singular terms ends in the suffix iris, the plural is usually formed by changing the is ending to the ides, ides. For example, arthritis, arthritides, meningitis, meningitides. Okay. One example more. If the singular terms in the suffix um, the plural usually is formed by changing the ending to an a. For example, the verticulum to the verticula, ovum to ova. Okay. Check all the examples, practice with them, and then it could be easier for you to understand these unusual plurals. It's the same as in English. These words are different and we have to consider. Another one, if the singular term ends in suffix us, the plural is usually formed by changing the ending to an I. Alveolus, one alveolus, two alveoli, two or more alveoli. Malleolus, one malleolus, goes to malleoli, two or more malleoli, okay? In order to consider it and to write in the, to make the writing down in a correct way. So now I think we are in the position to start with the contents of today. There's a lot of things we must check. So we have to talk now about signs and symptoms, about bones, general view of bones, joints and muscles, a general view of them because it's a lot of information and maybe we are making a resume of the first years of the medical school at this moment, okay? Talking about the signs and symptoms, we must consider the definition of them, okay? Luis Gerardo, can you listen to me?
Yes, yes, teacher.
Thank you so much. Can you read this slide, please?
Describing problems.
Okay.
Symptoms, all the problem which a patient reports to the doctor, also called complaints. Signs are what the doctor finds, also called findings. To report symptoms, doctor says, in case of notes, the abbreviation CO is used, CO chest pain. Mr. Gomez was admitted complaining chest pain.
Okay, thank you so much, Luis. So you can see in this picture, we have the first abbreviation that is very important, and we are going to use this all of the course, the model 1 and 2. The CO, the complaining of. The complaining is that situation where the patient is going to visit us. That's easy. Mr. Gomez was admitted complaining of chest pain. While writing, in order to use in a better way the time, we use CO chest pain, and that's enough. That's the first step for writing down the case report. Considering the most important symptom, of course, we go ahead with the most important complaint. findings, when we talk about the science, of course, the common term is findings, not science. Science could be confused in another way of talking, but findings are the most common way of expression, I mean. Well, on presentation, of course, we all know how to say. We all know how to present to a doctor, but we all know how to listen to our patients and consider when they are talking. For example, patient says they went to see the doctor or they went to the doctor. Doctor says the patient presented. You can see both of them are in past, because when you report a case, you are talking in past all the time. You cannot say we in the present time while talking in this moment, because you are reporting a case, you are showing an event that was in the past, but now you are discussing the situation, okay? Presenting the symptoms could be the symptom which causes a patient to visit a doctor. The synonym, presenting complaint, the presentation. For example, his presenting symptom was chest pain. His presenting complaint was chest pain. Again, we are in past. He presented to the GP, the general practitioner, with chest pain. The usual presentation, now at the moment of the discussion of the case, is chest pain. So you can see, when you report a case, always in past. Going ahead. It's a very important tip to consider to talk in past in order to make a good report and showing the symptoms. This chart is one of the most important we are going to practice, because we can see the symptom in black and words, the meaning of the medical terminology, and how the patient says about the problem, how the expressions they usually use. Of course, they are just examples, and maybe they can change the way of talking, and it could be a little difficult sometimes to understand them. Angelica, can you listen to me?
Yes, Doc.
Okay. Thank you so much. Can you read these two third charts, please?
Okay.
The tiredness and malaise, just both of them, okay?
Okay. Tiredness, lethargy, fatigue, lassitude, meaning loss of energy. Patient says, I feel tired all the time. I feel completely worn out. Lately, I've been feeling completely exhausted at the end of the day. Malaise, general feeling of beginning unwell. I feel unwell. I don't feel well.
Yep.
I've been
Malaise.
feeling. Sorry.
Malaise. I've been feeling off color for 2 days.
Okay.
Angelica, is
I
everything
haven't
okay?
been feeling myself for a week. I've been out of sorts all day.
Thank you so much. So you can see patients use lots of expressions to refer about the symptom. And we as doctors have to get the correct interpretation, the correct translation maybe, and get the meaning of what they are telling us, and then check, then analyze and get the correct medical term. Why is this important? Because while writing the clinical history, the medical report, the case report, you have to use medical terminology, not the expression of the patient. Sometimes we can use the expression of the patient if the expression is so, it could be confusing, I mean, and could be a very important tip how the patient expressed that idea, but it's not a usual situation. Okay, It's important to take it in account because you cannot say the patient says that he was out of color, was feeling out of color, for example. That's a mistake to use that kind of expression. You have to say the patient came complaining of malaise and the rest of the symptoms of the complaints, okay? Rochelle, can you listen to me? Rochelle.
Yes, I can listen you, doctor.
Thank you so much. Can you finish reading this chart, please? Anorexia, weight gain, weight loss, and constipation.
Of course, anorexia, meaning loss of appetite. Patients say, my appetite is very poor, or I have been off my food for days. Symptoms, weight gain, and the meaning is increase the weight. And patient says, I have put on 8 kilos in the last year, and I have gained 5 kilos. Next, weight loss, and the meaning is decrease in weight. And patient says, I'm not eating any less than usual, but I have a lot of weight recently. And the last one is constipation, and the meaning is hard in frequent feces. Feces?
Yeah.
Okay, and patients say my emotions are very hard, or I have been quite constipate lately, and I am not very regular.
Thank you so much, Rochelle. So you can see the expression of the patient is different from the symptom, from the meaning they are trying to refer. It usually happens, it's very common. And by experience, I tell you, if you don't understand what the patient is referring, don't be shy and ask again and again and again in order to get the correct information and get the correct symptom. That's the best way of doing this, okay? We have to consider that the verb feel is also used with other adjectives such as hot, cold, nervous, anxious, dizzy, weak. She said she felt dizzy. That's just as an example. You can see this expression, she felt, she said, it's not a very elegant, a very polite way of writing down. Maybe in an oral, a verbal report, but not by writing down because of the legal implications it could have, okay? Let's go ahead. Now we have lots of check. Well, with the next slides, I'm showing you a huge list of symptoms and signs that is better to check and read and find the meaning while studying, while using a translator. Maybe I'm going to send you a dictionary at the end of the class in order to get the idea what is going on, okay? Check the lists, please, and read them. During the workshop, I'm going to ask from the list, and anything that is not very, that couldn't be understood, I mean, we can talk about it and get the correct meaning, okay? You can see that's a huge list. Now let's talk about bones. Bones, of course, are the first anatomical structures we usually study. And it's a nice system, I think. We have this chart that is showing us the major structure, the relating combining force, and the primary functions. Why it's important? Because here we have the word root in order to understand what we are talking about. That's why I like to use this and show you. As major structures, we have bones, bone marrow, cartilage, joints, ligaments, synovial membrane, synovial fluid, and bursa. So we have to consider this, okay? The word parts specifically, just few of them because it's the example that the book was showing me. We have to consider them again as word roots and some suffixes and some prefixes and some combinations for writing down in a correct way. Ankyl or ankylo, arthro, chondri or chondro, costo, crani, cranial, the thesis, keep, kipo, lord or lordo, lysis, miel or mielo, os, osi, ost, osto, oste, osteo. Of course, we know all of them. Scoli, scolio, spondil, spondilo, synovi, synovio, synovo, ium. When we get this hyphen, of course, this is the suffix, right? Just as a remembering of the anatomical structure, we have the bone tissues. Ronald, can you listen to me? Ronald Santos. Hi, Ronald. Well, doesn't matter. Ronald. Okay.
Good
he's
evening,
not
teacher.
listening. Okay, thank you, Ronald. Just on time. Can you read this slide, please? Just the text, not the picture, okay?
Periosteum,
It's the bone tissues and all of the list, please, from 1 to 7.
periosteum, compact bone, cortical bone, spongy
Yeah, spongy.
bone, concilious bone, medullary cavity, medullary and medullary. Endosteum, bone marrow, red bone marrow, hemopoietic,
Yeah, hemopoietic.
hemopoietic, yellow bone marrow, cartilage, articular
Yeah,
cartilage,
Yeah.
meniscus.
Meniscus. Thank you so much, Ronald.
You're welcome.
So you can see, just remember the anatomical review, okay? But check this because it's important. Now we have the first self-study homework, moreover to the symptoms and signs. We have all the bones again, okay? We have to consider all of these structures because it's anatomy, we have to check them. We are going to evaluate this during the workshop and maybe in the final test and homework, that's okay. Just for remembering and getting the correct way of writing down. Of course, it's important for us. For example, we have the sacrum, the coccyx. Never forget how to use the double C, Y, and X. It's very important. Maybe with the patella, the double L, and in the social expression, the kneecap. Moreover, for example, we have the carpal or the wrist, the common expression, the wrist. Another one, for example, the forearm, very common in the common expressions, but we have to consider the ulna and the radius, the hip bone, the pelvic girdle, the ilius, pelvis, and ischium. So you must check the way of writing down and practicing about it. Any question about pronunciation, there is no trouble to work during the workshop, okay? That's my function, that's why we are there. So going ahead, we must consider the common names. We have the common name, how non-doctors talk to the structure, and the anatomical name, the one that we must use during the report, the case report, the medical report, the medical history, the physical examination. It's a very huge mistake to use this kind of names or the way of talking about it when we make the report in English. It's not the correct way. It's different from Spanish. In Spanish, we can use the social structures, the social way of talking about it, but not in English. It's because the polite way of talking about it, and sometimes we consider it's not important. It could be happen, but no. The objective of this is to do it in a good way. Roger, can you listen to me?
Yes, teacher.
Thank you so much. Can you read this slide, please? Wait, I'm sorry.
Okay. This one, fractures. Okay. Common
Yes,
names.
this
okay.
slide.
Common
common
name.
name and the
Okay.
anatomical name.
Common name skull. Anatomical name cranium. Common name jawbone. Anatomical name mandible. Common name spine. Anatomical name vertebral column. Common name breastbone. Anatomical name sternum. Common name rib. Anatomical costa. Common name collarbone. Anatomy clavicle. Clavicle? I am no. I
Yep,
don't
that's
know.
okay, clavicle.
Clavicle, okay. A common shoulder blade. Anatomical scapula.
Scapula.
Common, okay. Common thigh bone. Anatomical femur. Common name kneecap. Anatomical patella. Common name shin bone. Anatomical tibia.
Thank you so much. Thanks so much, Roger. So you can see this is a piece of cake maybe, but while writing down, we usually get in confusion and exchange them. So going ahead, talking about fractures, one of the most common situations that we can find, of course, is the break of a bone. We have the pathological fracture, and the fracture is a diseased bone. Well, for example, the fatigue or stress fracture. Well, due to repeated minor trauma, for example, long distances marching or running, we all consider this, and the typical bone fractures and classification. The Goring stick for kids, the spiral, the commuted, the transverse, the compound, and the compression, the most common situations we could find. We have more structures and patients tell to us these situations. The tight fracture, a committed one, forearm fracture, a double fracture, right? With oblique, the skull fracture. Then we have the finger fracture. You can see again a transverse, a rib and clavicle fracture. You can see a compound fracture. That's a mess in this thorax. This spine fracture, this leg fracture, toe fracture. You can see there are some examples about this. And that's the way when patients come to tell you, I have a forearm fracture, and they show you the structure without the information, and it's very funny. But we have to consider this. Of course, we know what a green stick fracture is, when it happens, and how to solve this. Just for information, I'm showing you this. For example, the chalk stick fracture. It's not a common imaging to find, but it's nice. I like to use this example. We have the compression fracture. You can see the difference in these X-rays. We have the stress fracture, not very common to see at the beginning, but now you can see this. We have the healing bone process. Just for vocabulary, it's not going to take to the test, just for having the idea what is happening with the bone while solving the situation. The process of healing, of getting in a good way, I mean. And we have the explanation of this. The hematoma formation, the hematoma is converted to granulation tissue by invasion of cells and blood capillaries. We know all of this, right? Maybe Angelica, can you listen to me? Angelica Fontova.
Yes, Doc.
Thank you so much. Can you read from 2 to 4, please?
Okay.
In this chart, you have lots of vocabulary that is going to be useful for you, for everybody.
Soft callus formation, deposition of collagen and fibrocartilage covers granulation tissues to a soft callus. 3. Hard callus formation, osteoblasts deposit a temporary bony coir around the fracture to anti the broken pieces while ossification occurs. 4. Bone remodeling. Remodeling, small bone fragments are removed by osteoclasts, while osteoblasts deposit woven bone and then convert it to a lamellar bone.
Okay, thank you so much. Deposit woven. It's an open woven one, but that's okay. Thank you so much, Angelica. So you can see for vocabulary, it's going to be useful for you, just for getting the idea and then considering these new ways of expressions. Moreover, we have this example of pathological fractures during birth, and that's easy. And it usually happens in many, many situations, but well, I hope it never happens with your patients. Of course, I'm showing you here more vocabulary in the chart. Please check this because it's important. Here you have the way of expression about describing X-rays, okay? Homework again. And of course, we have the treatment of fractures. And while the treatment, we have to consider these expressions that are in capital letters, okay? When the fragments of a broken bone heal and join together, they unite. Union may be promoted or helped by reducing the fracture. We all know we reduce fractures and we replace the structures to its original place. We are reducing the structure, we are reducing the fracture, and then we can use the correct treatment that we are going to check. By reducing the fracture, replacing the fragments in their anatomical position if they are displaced. You can see wild movements, that it's not the correct way, wild surgical solution, right? After that, after reduction, excessive movement of broken bone is prevented by fixation, either external, for example, a splint or plate and screws. We have the plate and we have the screws, right? If we don't use this, a displaced fracture which is not reduced may result in malunion, incomplete or incorrect union. You can see the structure is not the original one. Yeah, it changes this structure. This specific vocabulary is going to be helpful, so practice this and then we are going to talk about it during the workshop, okay? Complications of fractures, as we were saying, malunion or maybe non-union to consider as new terms. And now we have to check the differences between cast versus splint, just as information and getting the vocabulary of this. The cast, reading some of them, it completely encloses and encircles a limb. The splint only partially encloses and encircles a limb. We have the picture here for catching the idea. We have the cast, we have the splint, okay? Moreover, the cast is not attached by Velcro straps or bandages. The splint is attached by Velcro straps or bandages. We can take it out. Always custom made, the cast, and the splint not always custom made. The cast cannot be attached by an MT in the field, emergency medical treatment in the field. It's not for pre-hospitalian attention, can be attached by the MT in the field. It usually is made by the medical technician, emergency medical technician in the pre-hospitalian attention. The cast has to be cut off by a saw or blade to be removed. The splint can be removed by unstrapping or unbandaging. No saw is needed. Easy to take out the splint, we all made this. The cast cannot be adjusted if swelling decreases or increases. The splint can be adjusted if swelling decreases or increases. It's a very comfortable piece to work on if it's possible. The cast takes quite a long time to make. The splint takes a short time to make, easy to make. I think all of us made a cast, made a splint during the medical school, or maybe while working, depending on the place we are doing our job, right? Knowing the differences, it's easy to get a new vocabulary and talk about it. And this is a joke. I always like to share with jokes. It's an important way to do it. It's for breaking ice. Talking about joints, we have to consider that they are also known as articulations. It's the place of union between two or more bonds. We all know everything about it. We all know the definition. About the anatomical landmarks, the anatomical review, we have this common structure, this common picture that is always used in the anatomical references during the med school. And this is a diagram of a typical synovial joint. Read this, check this, because I'm going to ask about it during the homework and tomorrow in the workshop. And well, here in this slide, we have the fibrous joints, cartilaginous joints, and synovial joints. Gabriela, can you listen to me?
Yes, I can, teacher.
Yes, thank you, Gabi. Can you read this slide, please?
Yes. Fibrous joints, inflexible layers of dense connective tissue hold the bones tightly together. Fontanelles, known as soft spots, newborn, sutures, adults, cartilaginous joints allow only slight movement. Bones connected interiorly by cartilage, I guess. Ribs connected to the sternum, pubic symphysis, synovial joints allow a variety of motions, articulate, come together.
Okay, thank you so much. So you have some examples just for considering this and practicing, because here we have more vocabulary. It needs time to be read, I mean. Here in this slide, we have the classification, the 6 major types of synovial joints. And well, we have to check all of them. That's why I have our red bag. He's showing us that it's for self-studying. Please check this, and any question about pronunciation, please let me know, okay? Moreover, the difference between tendon, ligament, and cartilage. Yeah, we have the definition, the nature, the types, and the function. This is an informative slide, and we have more ways of expression, the correct way of talking about it. And moreover, we have the definition. For example, tendon. A tendon is a band of tissue that contains muscle to bone, that connects, muscle to bone. The ligament. A ligament is an elastic band of a tissue that connects bone to bone and provides stability to the joint, right? And the cartilage is a soft, gel-like padding between bones that protects joints and facilitates movement. So taking the definition, easy to make, easy to understand, easy to work with this. Well, we have the nature, the types, and the function. Check all of them in order to get the vocabulary again. I'm telling you about it because we don't have enough time. I'm sorry, I would like to take it more time, but it's not possible. These charts, these big ones, in all of the systems, I'm going to show you a chart like this, I mean, the pathology of the skeletal system. And we're going to divide the most important ones, not all of them, because it's going to be so large. But we have to consider the way of writing down these situations, I mean, these pathologies. For example, with joints, the ankylosis, you see we have a Y in the middle. The arteriosclerosis, the TH, the bursitis, the chondromalacia, we have the CH. So this way of writing down is very important in order to find the prefixes, the suffixes. It's easy to make when we check the best way. I'm sorry, here we have some names. For example, Becky and Catherine, I didn't take them out. I'm sorry, I'm going to correct it before sending to you. But it's just for getting the idea, okay? For example, the craniostenosis, while checking the beginning of the prefixes, suffixes, the construction of the medical term, we can understand this meaning easily than memorizing just the meaning. That's why I decided to start in that way, okay? Read this, practice with this. We are going to talk about it, okay? Going ahead. We have the muscles again, talking about this chart. We have the major structure, the related combining form and primary functions, muscles, fascia, and tendons. With muscles, the related combining forms, musculo, myo, myos, or myoso. Fascia, fasci, fascio. With tendons, teno, tens, tendo, tendin, or tendino, right? And the primary functions that we all know about it. The word parts, considering that this is the prefix because we have the hyphen at the end, the by, twice double or two, we know it. We have the hyphen and the suffix, the sile, the dis, again the hyphen, fasci or fascio, the word rod, fiber or fibro, the fibrous tissue fiber, we know. Again, a suffix aya, another suffix ic, kines, kinesio, kinesio, the mayo, the plesia, the rexis, the tax or taxo, teno, tendo, tendino, tono, and the three, right? This is the for three, the number three, we know about it. Please check this, it's very important in the way of doing the correct way of constructing the medical term. The structures, just for remembering the anatomical review, the structures of the muscular system, we have this slide showing the detail of how it is done, just for vocabulary again. And we have this picture that I like to match because we get the tips about musculoskeletal anatomy tips with tendons and ligaments. Tendons connect muscle to bone and ligaments connect bone to bone. So you can see just an information picture. Don't worry about it. Moreover, we have the types of muscle tissue, the skeletal muscle. Jael, Fernanda, can you listen to me?
Yes, I can.
Yes, can you read this slide, please?
Attack to bonds, make possible body motions, voluntary muscles. We have conscious control over these muscles, also known as straight muscles, straight.
Thank you, but the pronunciation we're going to correct a little bit. It's not muscles, not just forget the C, muscles.
Okay.
Okay, forget it, repeat please. Not muscle, muscle.
Muscle.
Thank you so much. While working in this way, well, we are going to improve all together, okay? Don't take it personal, sorry. So the skeletal muscle, easy to make, we always know about it. The smooth muscle, Pamela Sarabia, can you listen to me? Maybe she's
Yes, Miss.
Yes, thank you so much.
Good night.
Good night. Can you read this slide, please?
Yes. Locate in the walls of internal organs such as the digestive tract, fluids, veils, and ductus leading from glands. They move and control the flow of fluids throughout these structures. Involuntary muscle, they are under control the anatomic nervous systems, also known as unstraight muscles,
Yes.
visceral muscles.
Okay, thank you so much, Pamela. Please repeat after me, okay?
Yes.
Digestive.
Digestive,
Yes, digestive. Thank you so much. Another one, blood.
blood,
Yes, it's an exception during pronunciation. When you see two O's together, like this, O and O, usually
Blood.
it's pronounced like a U, but blood is an exception, a grammar exception. This grammar tip is going to be so helpful. It's just with this word, you say like an A, blood, opening the mouth, okay?
blood.
Blood.
Okay.
Thank you so much. Another one, please. Vessels. The way of writing down is vessels because it's in plural, but the pronunciation is vessels.
Vessels.
Thank you so much. And again, muscles. Forget that the C is at the middle of the word. Just said muscles. Okay.
Okay, Miss. Thank you.
Thank you so much, Pamela. Yes. Okay. Okay, going ahead. We have the myocardial muscle, and we have to consider the principal structures of this, also known as myocardium or cardiac muscle. We were talking about the Jung prefix. From the muscular walls of the heart, involuntary muscles in the constant contraction and relaxation to cause the heartbeat, in appearance, look like a strained skeletal muscle. Okay, these are the principal characteristics. Here in these three last slides, we have lots of vocabulary to check, to practice, and of course the pronunciation too. So there's no problem. Tomorrow during the workshop, we are going to practice again, okay? There's no trouble for me. About contrasting muscle motion, we have to consider the flexion and extension. We all know about it. When a muscle gets inflection, the opposite one, the opposite group, it's in extension. That's just for remembering, for reminding, and considering the movements, the pronation, the supination, the dorsiflexion, the plantar flexion, the abduction, the adduction, the circumduction, and the rotation. We all know all of the concepts and the meanings of these terms, just for practicing. And the general anatomical review, checking the superficial muscles. This red bag again is here. I know we are going to hate this, but we have to check all of this and practice. The same as we were talking in the first class on Monday. Here we can find terms in English, even though the same in Latin, because in the way we were talking yesterday, Latin and English are equal, are the same for doctors in medical terminology in other countries. That's why we have to practice with them, and don't be afraid if we found. So try to read them and there's no trouble, okay? Study them, and of course, this kind of slides, maybe some details are going to be into the homework. Well, about medical specialties related to the muscular system, we have to consider this. First of all, in parentheses, we have the pronunciation of the words that are not very common, I mean, or the words that are maybe new or difficult, that could be a trouble. An exercise physiologist, we have the description, is a specialist who works under the supervision of a physician to develop, implement, and coordinate exercise programs and administer medical tests to promote physical fitness. Another one, neurologist. The neurologist is a physician who specializes in treating the causes of paralysis and similar muscular disorders in which there is a loss of function. Okay. The physiatrist is a physician who specializes in physical medicine and rehabilitation with the focus of restoring function. Rehabilitation is restoring following disease, illness, or injury of the ability to function in a normal or near normal manner. Very important, right? And the sports medicine physician specializes in treating sports-related injuries of the bones, joints, and muscles. We all know about this. We all been practicing about this. This list is going to be helpful because we're going to talk at the end of the model 1 about that kind of jobs, okay? Now the pathology of the muscular system, we have again this big chart showing us some examples about the situations. And well, you can see here we go with the same suffixes to construct the medical term. And just we have to practice them. Please read them and we can talk about the meaning tomorrow. Spasm, cramp, for example, in Spanish, the meaning could be confusing and we can talk about it. Fibromyalgia, for example, fasciitis, for example, tendinitis, going ahead. The atrophy, PH is pronounced like an F, we all know about this. The myorexis, we found this, sarcopenia. Another one, for example, the sprain, the strain. You can see just one letter is changing, but of course the meaning is completely different. The compartment syndrome, we know about it. Overuse injuries. We have to consider all of these situations. Just as an examples for practicing, for catching the way of writing down, and that's all I think. And remember, never give up. Great things take time, okay? Take time to study, take time to complete checking all of these slides. I mean, it's a lot of information and I'm sure not all us, no, it's not easy to get enough time in order to study. So now it's moment to make our best effort and go ahead, okay? At this moment, any question? Something you would like to check in a first view at this moment? I mean, sometimes an hour, it's not enough time to check all the material we have to study and practice on, but we have to try to do this. Okay, if there are no questions, I'm sending the diary pool in order to get assistance, okay? Okay, please fill the pool, everybody. Okay, there is one student who didn't fill the pool. Please check. Okay, everybody filled it. Thank you so much. Tomorrow we have lots of things to check in the workshop. I know 15 minutes, sometimes it's not enough. Please check the slides. Don't worry about asking questions. My job is here for helping you. And if we didn't finish the workshop yesterday, or maybe tomorrow we don't finish solving doubts, that's okay if we talk by WhatsApp. There's no trouble for me, okay? We can, the objective of this, I mean, is to learn, to practice, and to get the relation between English and Spanish in order to get it clear, okay? Anything you would like to ask again? If there is nothing, you can go home. You can go for check-in, for studying. Give me 10 minutes for sending you the slides, okay?
Okay, Doc. Thank you.
Okay, you're welcome. Okay, thank you. Dennis, you raised your hand.
Yeah.
Let me know.
Sorry, the last time I didn't understand the time when we were doing the workshop. So maybe tomorrow I will ask again about the time if there is no problem.
No, there is no trouble. Don't worry.
Just to make sure, because the time, the difference.
Okay, we are going to workshop in order to the GMT4. Okay, because at this moment I live in La Paz, Bolivia, and the schedule is different from your country. You're from Honduras, I mean, right?
I'm from El Salvador.
El Salvador, but, I'm sorry.
Right at this moment, I'm in the USA, so maybe the time is not going to be the same.
Yes, it's different. Now here in Bolivia is 9 and 10. What time is in El Salvador?
Is 1 hour less.
1 hour
it's
less.
Not, I'm like I told you, I'm not in El Salvador right now.
Okay, don't worry. Tomorrow, while starting the workshop, I'm going to send a message to the WhatsApp group, and I'm telling where to send the workshop. So considering the list, the order, you can check and get into. Okay.
No, and I
we
see
can do something extra. For example, if a student comes late because anything could happen, I'm going to send a message to the group asking for the one that it's going to get into. Okay. For example, if you are late, I'm going to send a message to the WhatsApp asking for you to get into the workshop in order to get in.
I will appreciate that. Thanks.
Okay, don't worry. We are going to start working in that way. Okay.
Thank you very much.
Okay, don't worry. I understand, because this is a not easy situation sometimes because of the change of time. Okay.
Yeah, I understand. Thank you.
Okay, don't worry. Okay, Karen, you're sending me some messages to the chat about homework. Well, at this moment, during the class, during the slides, we get this red bag that I was telling you at the beginning in the first presentation. This bag, this red one, is reminding us that there are many things for self-studying. The self-studying is going to be so helpful in order to get the vocabulary and practice the English. Writing the homework as a fact, I'm going to send it tomorrow night while finishing the workshop. It's going to be with some exercises for practicing all the contents of this week. The anatomical reviews, some sentences, some complainings, many different situations, I mean. And I'm going to give you enough time, 3 or 4 days maybe, to send it to me in order to check, to evaluate, and then send you the answer keys for studying. So tonight, just check the slides, practice the vocabulary, and any question you get, tomorrow you can let me know. And then we can solve the doubts, and it would be easier for you to work. Is that okay? Did you understand?
Yes, Miss. Thank you.
Perfect. Just check the slides. All the homework is from the slides. Nothing is going to be different or from another textbook or something that I didn't teach you, because the objective of sending you the slides is to give you the material for practicing and getting the point of start, I mean, the beginning of this new way of expressions. Okay. Okay, so I think it's all you the slides of tonight. I know it's a lot of information. I would like to take more time, but at this moment it's not possible. So let's finish. Yeah, let's do it. Yeah. And don't worry, everything's okay. I mean, we have the assistance and practice. That's all. Okay. So see you tomorrow. And as I was telling to Denise, I'm going to send messages in order to start the workshop.
Thank you, teacher. Good night.
Good night. Bye, Luis. Bye, Karen. Bye, Dennis. Ronald, can you listen to me? Ronald. Well, at this moment, we are finishing. I think that Ronald is without phone at this moment. Well, there's no trouble. I'm going to finish the situation. I'm going to finish everything.